Okay, so we are back with our webinar 104, and I welcome each and every participant to this webinar organized by PsyCoolG Connect, an initiative by PsyCoolG Wellness Private Limited. We have already completed 100+ free webinars, so you can check out all the webinars. If you have not watched yet, you can go to our YouTube channel, and every webinar is free of cost. You can go and update and upgrade your information from there. So, my name is Dinesh, and I'm the director and founder of PsyCoolG Wellness Private Limited, and I will be there to introduce to you the topic of the webinar first of all, and then we will be starting with the webinar. Our resource person, Dr. Jeny ma'am, will be there with us. So, yeah. So before starting the webinar, I would like you all to know about this particular topic. This topic is all about OCD, obsessive compulsive disorder. So all the psychology students, like, they have this curiosity of knowing what exactly OCD is. So for them, this webinar is the most important webinar. So kindly listen till the end, because our expert had made a lot of efforts to organize this particularly. So yeah, so let me introduce you all to our resource person for the day. Ma'am Dr. Jeny is there with us. Ma'am Dr. Jeny has had 20 years of experience in the field of psychology and teaching. Ma'am, I welcome you. I wholeheartedly welcome you to this platform, PsyCoolG Connect, to giving us a free webinar once again to share your knowledge to all the audience, because this is really important. Because if we do not share the knowledge again, the knowledge will be like packed. So whenever we share the knowledge, it multiplies itself. So this initiative we started, and ma'am have regularly contributed in this particular initiative by giving us multiple webinars from the beginning till the end. So there are many multiple webinars. If you can check the playlist, I will just mention the link down, so you can check all the webinars given by Jenny ma'am, and they are super knowledgeable. So you can, everybody, I would request everyone, so you can check this out through the link down. Ma'am, I do welcome you in this webinar. Wholeheartedly welcome you to this particular webinar number 104, organized by PsyCoolG Connect. And the topic is OCD. And today is a special day. By the way, happy Children's Day to all. This again
Yes.
is a special day and a special webinar on OCD. So I will be also learning, and every participant is waiting for your turn. So, mic is all yours, ma'am.
Thank you, Dinesh sir. Thank you so much for the director of psychology. And first of all, let me declare that I feel very proud to be here on this platform to speak about this topic because I feel very much grateful and happy to speak from this platform, especially because I'm very much impressed by the work done by psychology team. You just visit their website, that's what for, which is for their 100% dedication to their cause. You see, number of webinars they have conducted so far. I can't help contributing to their cause because, as Dinesh sir mentioned, that knowledge gets spread and reach to the needy hands only through the medium called sharing. And in this
Yeah,
21st century, this medium of sharing, they are making use of it, of use of that medium very in a very dedicated and committed manner. And 104 webinars, and I am the 104th one, webinars they have conducted, they have kept in every webinar they have kept in the YouTube medium so that you can at any time you can refer those database in order to upgrade and refresh your brain with respect to the knowledge and information in various topics in psychology. For the same reason, I visit this team frequently because I feel that I must do what I can for the upliftment of this team so that they will keep motivated to contribute towards the cause of mental health. And
Thank you, ma'am.
once
Thank
again,
you for
yes,
your
yes, yes.
contribution.
Now, regarding today's webinar, obsessive compulsive disorder, uh, I would like to say that I will be sharing scientific information. This webinar, compared to the previous webinars I did, will be a little bit different. That is, I will be sharing the fixed scientific facts and nothing much more to add from my part, personal part. Of course, from personal experience, from the clinical experience, I can add, but this webinar will be most benefited. As Dinesh mentioned, that this webinar will be beneficial to the psychology students. So, the psychology students, first of all, I ask you to attend to this webinar from the beginning to the end.
From
Then
the
only you
beginning.
can have, yes, from the beginning to the end. And then only you can have a good grasp. I have added latest findings, research findings in the especially in the area of neuroscience. What is the contribution of neuroscientific facts, neuroscientific research towards understanding and dealing effectively with this disorder called obsessive compulsive disorder. So, without wasting much time, let us enter into the presentation. After the presentation, if you have any doubt regarding the things I am presenting, you can ask. So, listen, here goes.
Yes, ma'am.
Obsessive compulsive disorder aware of this disease. For those who are very much aware of the features and goals of the disease, symptoms of the disease, this session I promise that will be a refreshing one. For the other group who are not aware of this disorder and its features, I promise that this will be a great learning session. You can have a better understanding about this disorder. And regarding this disorder, obsessive compulsive disorder, you know that the word or the label or the title of the disease itself conveys a lot of message. That is obsession. The word obsession stands for thought, not the ordinary thoughts or normal kind of thoughts. The thoughts have certain features. That is, they are repetitive, they are intrusive, they are uncontrollable. Intrusive means the person who is undergoing this flooding of thoughts do not want to have the person does not want to have those thoughts in his head. Such kind of stream of thoughts are flooding in his brain. And a compulsion means repetitive behaviors or mental acts that a person feels compelled to perform. Actually, the person who is undergoing some compulsion does not want to perform that behavior, particular behavior, maybe it washing of hands or wiping the surface of the table or searching for the key or checking the doors, locks, and all that. These behaviors they do not want to perform, but they are compelled to do so. And these are some important facts about OCD. You know that OCD is a disorder that has a neurobiological basis. That is, if you search for the cause of OCD in a particular person, you can see that certain key regions of the brain is being affected or the key regions of the brain are dysfunctional of the person or the patient suffering from OCD. We can trace some neurobiological factors or causes in the brain of the person suffering from OCD. And regarding the prevalence of OCD, it equally affects men, women, and children of all races. And based on community studies, it is estimated that the prevalence is 1 to 3% in a population. And onset of ACD, average onset of ACD is 19 years. And you see that according to World Health Organization, OCD is one of the top 20 causes of illness-related disabilities. You know that if we consider many psychological disorders, those disorders need not create some disability in the person or the patient undergoing through these disabilities. For example, depression, whatever it may be, depression, depressive disorders, and whatever it may be. In some or other ways, the person suffering from these psychological disorders get along with life in their own way. But OCD has that power. It can cause a state of disability in the person. That is, his day-to-day life will be impaired due to this disease. He cannot perform his actions in a satisfactory way, whether it is in the domestic front or it is in the working front, wherever it may be. It will interfere with his day-to-day life activities. That is, it can match more or less to a state called disability. And you see that prevalence, if we expand on the recent uh, information regarding the prevalence of OCD, it is this. That is, in United States statistics, this statistics is based on United States is 1.2%, but worldwide prevalence is 1.1 to 1.8. I already mentioned about it. And there is slight difference, gender difference is there with regard to prevalence. That is, females are affected slightly higher rate than males in adulthood. And in 2021, there recently came a report regarding the prevalence of OCD. That is 1.5 percentage for women. With regard in a population, 1.5 percentage is the rate of prevalence for women, but it is 1% for men. That is, the gender difference is not so serious actually, but it is there. And regarding the development and course, we mentioned earlier that 19 years is the usual age of onset for obsessive compulsive disorder. Even if it is so, 25% of the people affected by OCD seems to have their age of onset around 14 years. That is, there is likelihood of emergence of this disease in a particular person in the adolescence itself. But if you crossed 35 years, be safe. You are safe. You are in the safer side of the issue. Because if after 35 years, there is the onset of this disease is very unusual. It is not likely to happen. So if you have crossed 35, you are not likely to be affected by this disorder called obsessive compulsive disorder. Males have earlier age at onset. If OCD is affecting a male, there is high likelihood for being affected in their adolescence or in the earlier age. That is, in the males, this presence of OCD can be noticed even at 10 years. Yes, children suffering from OCD, obsessive compulsive disorders, you can see they will be boys rather than girls. In childhood OCD disorders, if you search for the statistical reports or regarding the prevalence, you can see that onset of OCD among boys are happens earlier than compared to the girls. And regarding the development and course, compulsions are more easily diagnosed in children than obsession. It is just because that is parents start noticing some abnormality in their children when the children exhibit or show some compulsive behavior. Usually, in any course of OCD, obsessive compulsive disorder, you can see that the compulsions are something that follows obsession. The triggering factor is obsession. Only after obsession it gives way to compulsions actually. But uh, when the child shows some compulsion, parents take notice of it and take the child to some clinicians and come to know that their child is suffering from obsessive compulsive disorder. And regarding the symptoms, symptoms means this the content of obsessions and the nature of compulsions, frequency of obsessions, and same as the frequency of compulsions. Regarding this obsession and compulsions and with respect to their symptoms, adults show stable pattern of symptoms actually. Adults, in the case of adults, their compulsions and obsessions will be constant. And either it will be related to some contamination or some guilt-inducing thoughts. There will be some stability. But in the case of children, the nature of symptoms regarding the content of obsession and the intensity of these compulsions, they vary among the children. Yes. I will give explanation for this difference later. In the later slides, I have some explanation why these symptoms remain constant in the case of adults, but the symptoms of OCD vary in the children. And we can label a person, a personality. We can label a personality is having obsessions if he or she satisfies these two criteria. The first criteria is this, that is, the person should have some flooding of thoughts, persistent thoughts, urges or images, which are like intrusions. Intrusions means intrusive. Intrusive means the person does not want those thoughts happening in his head. He wants to escape from it. He doesn't want it. But they are coming. It is out of control, unwanted. And this content of thought, sometimes if we analyze the content of the thought, this thought content and this happening of obsessions will be some sort of anxiety provoking, causing some anxiety in the person, or causing some distress in the person, or causing some sense of guilt inducing thoughts might be happening. So the individual, for the same reason, these thoughts or obsessions are capable of pushing the person into a state of anxiety, distress, and guilt feeling. For the same reason, the person wants to escape from it. So they make various attempts to ignore or suppress these thoughts, urges, images, and they somehow try to neutralize them. These are the common obsessions. Thoughts, kinds of thoughts that is flooding in the brain of the person suffering from obsessive compulsive disorder. Scared of dirt or germs, dread of bodily waste or fluids, overly concerned with order and balance. So some patients are very much concerned with the order and balance. So they will be arranging the things in a certain order. And even a single thing is displaced. For some or other reason, if single thing is displaced from that order, means they get agitated. They become restless and worry that a task was not fulfilled properly. They might have done it. They have completed some task, such as closing the door or finishing the writing, finishing some task, finishing the cleaning the pots. Simple tasks, they might have finished the task, but a sense of incompleteness pervade in their brain regions or in their thinking area or thinking style. We can say that they always feel that sense of an unfinished business, or this word unfinished business is related to just psychology. I'll just use the word a sense of incompleteness. And this sense of incompleteness happens in a painful way. That is, they have to restore this sense of incompleteness, or replace the sense of incompleteness with a sense of completeness to get the feeling that I have finished the task. They repeatedly engage in the task. They repeatedly check the lock, whether it is closed, whether it is closed, whether it is closed. Fear of bad or sinful thoughts might be there. And you see that preoccupation with the thoughts about certain sounds, images, words, numbers, craving for constant reassurance. You can see This is noticed in children, constant reassurance. That is, they might have done something beautifully. For example, a child suffering from OCD might have completed drawing a picture, but he is not satisfied with it. He asks the mother, "Mother, is it good?" Mother can assure him that it is good, it is completed, and it is you have done well. He goes to the room. The child goes to the room and checks the picture once again, and he makes some other, and he again takes the picture to the mother. Mother, please tell me whether it is okay, and he will be repeating it constantly. He can't stop. He can't assure himself that he has done well, and afraid of harming a family member or friend. This thoughts of harming some other friend, some other family members floods their brain, and such obsessions induces a sense of deep guilt, a sense of guilt in the brain of the patient. And one of the ways they attempt in order to deal with this unacceptable obsessions is engage in some behavior, repetitive behaviors or mental acts in response to an obsession. These compulsions or behavior, they choose it as a means for dealing with the obsessions. They wanted to escape from the obsessions or put an end to this painful, distressing, anxiety provoking thoughts. And they think that if they engage in some compulsions, they can, for the time being, at least for the time being, they can, they will get some relief from this painful thought. And you see that the behaviors or mental acts are aimed at preventing. The sole aim of engaging in compulsions is this: either it will be to reduce anxiety or to reduce distress or preventing some dreaded event or situation. And it is true to some extent that these compulsions helps the patient to deal effectively with the obsession and the related distress, anxiety, and the patient and this guilt feeling that the patient is suffering from actually. So obsessions, usually fear of contamination, leads to a compulsion of cleaning or washing rituals. If the patient is having some pathological doubt, it will lead to a compulsion like this, that is repetitive checking. And fear of causing harm. Thought content or the content of their obsession is that of fear of causing harm. The patient may engage in a compulsion called repetitive checking. Need for symmetry and exactness. Religious obsessions are there. Similarly, superstitious obsessions are there. So, compulsions, regarding the compulsions, they know, patients know well that these compulsions and even obsessions are time consuming and meaningless, irrational, and it causes impairment to their social, occupational, and important areas of functioning. But they can't just get rid of it, get rid of these compulsions and obsessions. And you must know that when the diagnostic criteria says that these compulsions and obsessions that is being generated inside the patient, we cannot attribute the cause of its triggering and substance. We cannot attribute it to some substance. That is, it is being triggered by consuming some medicines or by some substance. No, it's not like that, because this particular disease called obsessive compulsive disorder have neurological basis. So you cannot attribute to psychological effects of a subset. And you see that the patient will be having excessive worries, like in generalized anxiety disorder, preoccupation with the appearance, body, just like in body dysmorphic disorder, difficulty discarding or parting with the possessions, just like in hoarding disorder. So all these disorders, generalized anxiety disorder, symptoms that is noticed in generalized anxiety disorder, body dysmorphic disorder, and hoarding disorder may happen in the person suffering from obsessive compulsive disorder. These symptoms may appear as subcategories, not in all persons suffering from OCD, but there we can notice this body dysmorphic disorder. Body dysmorphic disorder means the patient believes that there is some what we say that something is wrong with his appearance. Patient believes that his hands are not in right shape, or his nose is not in right shape, or his face is not beautiful, and all that. Body disease, it might be imaginary from the part of the patient, that if he is imagining that he is looking bad or looking awkward and like that. And you see that this is a very important information that you must carry with if you are working in a clinical area, or if the person listening to this webinar is active in the field of counseling or psychotherapy, you must carry this point regarding the obsessive compulsive disorder. That is, we can categorize the patients suffering from obsessive compulsive disorder into three groups. The first group is the patients with good or fair insight. That is, the patient thinks this categorization has been made based on the patient's interpretation or patient's awareness or patient's insight into his own obsessions and compulsions. How the patient views his own state. Okay, how much insight the patient has into his disability or into his disorder. According to this criteria, we can categorize the patients into three groups. The first group is individual recognizes that his obsessions and compulsions may not be true. He does not believe firmly in his compulsions, obsessions. So there is better room for change. There is much hope for the patients with a good or fair insight. Perhaps the psychotherapy practices can affect, can do good to this kind of patients. Can be more effective in the kind of patients who belong to the first group. And the second group of patients, you can see that they are having poor insight. They think that they may be their obsessions and compulsions may be probably true. Probably true. They can't. They are not sure of it, but they somewhere in their mind they believe that they are true. Their obsessions and compulsions are true. And the third group of patients, they think that their obsessions and compulsions are true. They are afraid of germs. They are afraid of being contaminated by germs, and they firmly believe that there are germs. Yes, they firmly believe that they keep on washing the hands. In this kind of patients, there is less hope for for making change with the help of psychotherapeutic practices. They need some medications, definitely. Of course, all the patients, most of the patients suffering from OCD need some sort of medication in order to deal with their stage. But in this third category, it's highly difficult to cure them with the help of any additional means. Okay. Now, OCD happens in cycles actually. It begins from obsession. Beginning of any OCD cycle is from obsession. As we mentioned earlier, the content and frequency, regarding the content and frequency of obsession, so we can say that it comes like flooding with respect to the frequency. When we speak of frequency, it passes through the brain of through the thinking regions of the patient, like an unwanted, repetitive, intrusive fashion. With respect to the content, we know that these obsessions are either anxiety provoking or guilt inducing or creating some distress, deep distress in the patient. So these obsessions are in general not comfortable to the patient because they generate anxiety, distress, and all that. So they wanted to escape from them. And as a part of it, they generate some compulsion. So that is, they engage in some behavior. By washing hands, they are getting, for example, a person is having some obsessions related to being contaminated or being contracted by disease or fear of germs. By washing hands, what happens is for the first time when they wash their hands in order to get rid of the germs, imaginary viruses, they wash their hands. What happens is that definitely they will be getting some sort of relief, temporary relief. For the time being, their anxiety is reduced. So they make a conclusion in their mind. They form a conclusion in their brain that by engaging in by engaging in the act of washing hands, they can reduce anxiety generated by this obsession. And when the second time, when the obsession happens, they again engage in the same compulsive behavior or behavior they have selected in order to reduce the anxiety. And there forms a loop. That is, the patient repeatedly passes through these cycles for many times a day, means some sort of wiring is happening inside his brain. That is, between his thoughts and the consequent behaviors, strong neurological pattern is formed by virtue of the repetition that he is making. Means it gets so ingrained in his brain, this behavioral pattern that he has generated in order to compensate the pain caused by the obsession. Some neurological pattern is being fixed or being ingrained in his brain. That is, he becomes a victim of this cycle. Whenever obsessions obsessions are triggered, he is led to these compulsions. He has no control but execute or go through these compulsive behaviors. Okay. Anyway, the best explanation for the causes of OCD is given. Now, in this 21st century, the best explanation for the causes of OCD is coming from neuroscientific research, actually. There were explanations, many explanations were there, but they are getting outdated, actually. When this technology, when this development or the expansion of technology came, a technology revolution, with the help of technology revolution, we are now capable of looking into the brain of the patient while they are going through the cycles of compulsions and obsession. And so many research outcomes are coming from the science of neuroscience, from the science of this brain-related sciences. And they say that in any patient suffering from obsessive compulsive disorder, you can notice elevated activity in the frontal lobe and basal ganglia. These two regions are very salient in the case of when we set out to study about obsessive compulsive disorder from the perspective of neuroscience. That is, these two regions, the functional elevated activity in these two regions are noticed, actually. And we will be discussing about it. And you see that this is another fact, that is energy consumption. The rate and density of the consumption of energy is very high in the person suffering from obsessive compulsive disorder. That is, there is a rate of metabolism of glucose in certain regions of the brain are very high in the person suffering from OCD. That is, there is flooding of thoughts. As we know that the obsessions means that there is a train of thoughts, intrusive, repetitive, compulsive. Yeah, they have to spend much energy in their brain. No. So another fact is that we have, all of us have an anxiety regulating mechanism in our brain. Certain key regions of the brain work together in order to regulate the anxiety. In the normal people, we somehow learn to regulate and manage the anxiety provoking situations in our life. But in the case of OCD, person suffering from OCD, this mechanism that is being worked in the brain is it becomes out of balance, or they are dysfunctional in the case of it. And low in the case of OCD patients, there is lower supply of neurotransmitter called serotonin. Serotonin is one of the chemicals that helps nerve cells to communicate, usually in order to lower this region, anxiety-provoking thoughts and this. Certain neurochemical imbalance is noticed also. But you know that never think that obsessive compulsive disorder is something happened in an isolated fashion. You may experience obsessive compulsive disorder or symptoms of it or features of it or course of it if you have some these disorders, that is ADHD and this ODD and anxiety disorders. So this is not an isolated disorder. Obsessive compulsive disorder can happen, and it is in symptoms, and its course may appear along with all this. There is a chance of comorbidity. Okay, and you see that what kind of persons are likely to get affected by this obsessive compulsive disorder? The question is that vulnerability, regarding the vulnerability, the research findings say that persons with a certain temperament, certain peculiar temperaments, for example, persons with internalizing symptoms. Internalizing symptoms means there are persons who react to the stress-provoking situations or the risky situations in life with anxiety or depression or a sense of loneliness. That is internalizing symptoms. Persons showing internalizing symptoms are likely to get affected by OCD. And you might have learned about the big 5-factor personality. That is, persons with neurotistic trend of mending of a personality is likely to get affected by OCD. And behavioral inhibition in childhood. By virtue of the disciplinary practices of parents, some children are likely to experience behavioral inhibition. These children are likely to develop OCD. With respect to the environmental factors, if your child, if you need not your child, but yourself has been subjected to the sexual abuse in childhood or other stressful traumatic events in childhood, your vulnerability will be high. That is, your chances of chances of being end up in a state called OCD is higher. And you see that when we speak about genetic and physiological reasons behind the OCD, obsessive compulsive disorder, if you are a first degree relative of an adult who has OCD, your chances of getting OCD in your life is approximately 2 times. If you are a relative of first degree relative of an OCD patient whose onset of OCD was in childhood, suppose you are a first degree relative of a patient whose onset of OCD was in childhood, your chances of getting OCD is 10 times higher. And when we speak about this familial transmission of OCD, it is just this. Because of genetic factors, you will be born with some dysfunction in key regions of the brain. For example, orbitofrontal cortex, cingulate cortex, striatum. Certain key regions of the brain are there, which will be affected due to genetic reasons. It is just this. And these are the latest research findings which I have collected from the internet regarding the OCD. These are the best explanations. There are three explanations for why this happens. And these are the explanations which interpret the neurobiological basis of obsessive compulsive disorder. The first one is inhibitory control mechanism of the patient suffering from OCD will be dysfunctional. Inhibitory control mechanism. All of us have inhibitory control mechanism in our brain. What is this inhibitory control mechanism? It is just this. There are some emotions, there are some thoughts, there are some behaviors that we do not want to take out. It may happen inside us, but we are, as normal persons, we are capable of inhibiting unwanted thoughts, unwanted behavior, unwanted emotions. And we shape ourselves in such a way, our thoughts, behaviors, we shape in such a way, it is accepted in such a way that it is acceptable to the society. That is what is happening in the persons who are called normal people. But in the case of persons who are suffering from obsessive compulsive disorder, this inhibitory control mechanism in their brain will be damaged. They can't inhibit their thoughts, obsessions, and compulsions. And the next explanation is error processing. These are the latest studies, explanations produced in the field of research related to OCD. I repeat, it came out in 2018 and 2021. Regarding the error processing, even if we commit some errors in terms of our thoughts, in terms of our behavior, in terms of our speech, if we commit some errors, we recognize that they are errors. We process those errors in such a way that we must take care. We prepare ourselves in order not to repeat those errors. This is what is meant by error processing mechanism. So some key regions of the brain are involved in it. Error processing. These regions, these faculties of the brain are being affected in the patients suffering from OCD. Okay. And the third explanation is this neural basis of impaired safety signaling. As human beings, as animals in general, all animals have a safety signaling mechanism in their brain. That is, they are capable of distinguishing which signals are safe, which signals are indicate danger, which stimulus are conveying the message of safety, which signals are conveying the message of danger. They are capable of distinguishing clearly. But this capacity of the brain, for that functioning also, certain key regions of the brain, especially the primitive regions of the brain, which is related to survival mechanism, that is amygdala, limbic system, all these regions of brain are involved. As I mentioned earlier, some regions of the brain, many regions of the brain are affected in the patients who are suffering from OCD. So this safety signaling mechanism is impaired in the case of patients suffering from OCD. And these facts like this helps us as mental health practitioners, helps to have better insight into the state of or condition of the patient suffering from obsessive compulsive disorder actually. Okay. So you must go through these papers or research papers published in various journals. If you want, I will give to the team, psychology team. They will help you to reach to those documents and read well. And there are effective medications in the market. They are available. These medications are available nowadays. We can have and 5.7% for study. As I mentioned earlier, twin study shows that 80 to 90% concordance with mono. This genetic regarding the genetic information related to obsessive compulsive disorder. What I wanted to mention is that this is the key region of the brain which is affected due to genetic influence, that is basal ganglia. You just type this region, this name, basal ganglia, and study well about what is the functional importance of this region of the brain, that is basal ganglia. And striatum, and the patients are suffering from Parkinson's disease. You can see that these regions of the brain, certain regions of the brain, are impaired in such a way that they show the symptoms of OCD and are likely to show these things involved in the symptoms of OCD. And these are other medications used effectively in the treatment of OCD. But with regard to psychotherapy, there is much to say. That is, whatever it may be, whether it is cognitive behavior therapy or exposure and response prevention therapy, which therapy you are adopting, whatever it may be, the crux or gist of the therapy is this. The therapist helps the patient face the situation. Usually, these persons suffering from OCD, basically what they do, they wanted to suppress their obsession. They wanted to run away from their obsessions, or they wanted to kill those thoughts. That is, avoidance behavior is dominant with regards to their obsessions actually. But the patient, with the help of the therapist, this is the aim of the therapist, to prepare the patient to face those obsessions. Prepare the patient, have better awareness regarding their obsessions. Prepare the patient to face the anxiety, fear, and the distress and the guilt feeling in order to deal with it. This is the first phase of this any psychotherapeutic practices that we are depending on in order to treat OCD, and encourages the patient to suppress the need to perform the rituals. Whatever may be the nature of the compulsion that patient is resorting to in order to deal with the obsession, the therapist persuade the patient to suppress the need to perform the compulsion. That is, patient wants to wash his hands, but the therapist prevents him from doing so. Then what happens? Anxiety will be generated. Then, with the help of the therapist, the patient learns to face the anxiety. That is the first stage. Face the anxiety, confront the anxiety, observe the anxiety, develop awareness about his own condition. For the same reason, I will say, when a patient is suffering from obsessive compulsive disorder, and he is seeking the help of a therapy, means without the help of the family members or caretakers, he cannot make use of therapy and its strategy successfully. Yes, too much assistance is needed from the family members of the patient, or near and dear ones, or other caretakers, in order to deal with the obsessive compulsive disorder with the help of a therapy. Okay, it must be noticed. And this is the basic idea behind any therapy. Thoughts create feelings, feelings create behavior, behavior reinforces thoughts. And cognitive behavior therapy does this. That is, challenge the beliefs about the anticipated consequence of not engaging compulsion. If you ask the patient, do not wash your hands, you tell the patient, an OCD patient, the therapist asks, don't wash your hands, the patient will say that I will become anxious. It is his belief. He has developed a strong belief by going through the cycles of OCD repeatedly. The patient has generated some strong belief, conviction that if he does not perform the compulsion, it will cause distress in him, it will cause anxiety in him. The therapist, cognitive behavior therapist, challenges this basic belief to which the patient is holding on to. This is a process of cognitive restructuring, and it takes time and effort, not only from the part of the therapist, but combined effort is needed from the caretakers also. Okay, regarding the relapse, if you consume the medicine only for 7 weeks, there is 89 percentage for the 89 percentage for the 89 percentage chances of relapse. And if you consume the medicine for 2 years and you discontinue, suppose discontinuation of therapy, medication therapy, you discontinue, suppose that there is 77 to 80 percentage of chances for relapse. That is the case. But behavioral therapy increases the persistence of improvement after drug therapy is discontinued. Whenever you are discontinuing the drug therapy, whenever you are discontinuing the medication, of course, if you consume the medicine for obsessive compulsive disorder, for sure you will get relief. But when you discontinue the medicine, you must enter into some course of or I will say that some sort of therapy of your choice, and you must go through that, and you must learn strategies and techniques that is related to life, very much related. Medicine is a bundle of chemicals. It has nothing to say to you. This medicine consumption of medicine, with regard to consumption of medicine, medicines have nothing to say you. Medicines have nothing to say to you. But if you involving some therapy after discontinuing, when you are discontinuing, but that means that they will teach you how to, they will teach you effective techniques and ways to deal with this your compulsions, unwanted thoughts, and unwanted beliefs, and restructure your cognitive patterns. It will help. So seek the help of an effective therapist when you discontinue the medicine. And don't think that all the persons suffering from obsessive compulsive disorder are not likely to excel in their life. There are so many famous people who have had this disease called obsessive compulsive disorder. You know this person? This is a person in the film Titanic. He was the protagonist. And you see, reports say that this man, Donald Trump, American president, past American president, had this have this symptoms and elements of OCD in his personality. And this is a famous football player. I think that you know David Beckham. He has OCD. And you see, this is a famous artist, film actress, I think, Jessica. She has OCD. And you see, this is a versatile personality. He's a writer, he's a script writer, he's a producer, he's a director, and what or not he has. And this person, that is, the world has not seen a person like him again. And Albert Einstein had this disorder. So don't think that it is a debilitating disability, the disability-inducing condition. You can have a good life irrespective of you have or have not OCD.
Exactly.
Thank you.
Thank
Thank you
you,
so much.
ma'am. Thank you, ma'am. Thank you. And thank you for introducing so many personalities also at the end of this particular webinar, because many of the
Mhm.
people are still like they still think that mental health problems are not to be discussed in open, but mental health problems are also equal to the physical health problem. Like physical and mental health doesn't have any differentiation as such, but society have so many stigma, and so we need to remove all that stigma particularly, and showing these images of famous personalities do inspire people to speak up about their own personal mental health problems. It may be OCD, it may be anxiety, or it may be depression, it may be phobia. Any mental health disorder should be discussed to a counselor or should be taken to a particular professional. And people do need awareness, and that's why we started this series of webinar.
Ah,
So
good.
thank you, ma'am, for this wonderful webinar, an informative webinar. And I would request the audience, if they have any kind of questions, and if they have their own questions to ask, they can put all their questions in the comment section. Till then, there are few comments for you, ma'am.
Hmm.
You can see on your screen from the participants. Okay, so thank you, ma'am, for this particular webinar and for taking your time to spread awareness, to give us a part to spread awareness. And thank you, ma'am, for this informative session, and very informative, very knowledgeable session. And if you have missed, like I am telling the audience, if you have missed something, you can get back to this webinar. It is present on YouTube. There are many other webinars, informative webinars, they are present on YouTube itself, on our playlist. We will be mentioning all the links in the description. You can check the description section for all the links. If you have not joined our WhatsApp group, you can join our WhatsApp group for all the updates regarding the upcoming webinar and all the events related to psychology. We do post all the things, informative things, like we do not spam at all. So thank you everyone for joining. Thank you, ma'am.
Okay.
Thank you, ma'am, for giving your time
Yes,
for
yes, yes.
explanation and everything. Thank you, ma'am. We will be meeting
Okay.
soon again in another
Sure.
session.
Yes.
Yeah, and yeah, there is a request from a participant that bipolar disorder and schizophrenia presentation please arrange. Okay, for sure, we have noted down your request, and definitely we will be arranging
Uh-huh.
a particular webinar on bipolar disorder for sure. And yeah, very positive. Okay, one of the participants said that it was very positive and cool presentation. Yeah, thank you everyone. Thank you, ma'am, for this wonderful webinar, and we'll be soon meeting
Yes.
again in another episode and another webinar where we will be sharing much more other information. Thank you, ma'am.
Thank you. Thank you so much. Bye. See you.
All the participants can now get back to the description box, and the description section have the link of the certification, and the certification link is now open, so you can go fill the form. The certification will be released after 2 or 3 days, within 72 hours basically. So you can fill the form for the certification. The certification link is open. Yeah. Okay. It is open now. Webinar certification. Yeah, it is open. Okay, so thank you everyone for joining, and do subscribe to our channel for more upcoming psychology informative videos and informative webinars and workshops and everything. So you will be getting all the updates. Do subscribe to our channel, do follow us on Facebook and Instagram, and hit a like if you like this particular webinar. Thank you everyone for coming. Goodbye. Take care.